Okay, so let's continue on with case 22. A 22-year-old woman presents to the emergency department in labor. This is her first pregnancy and she has received no prenatal care. In the emergency department she has a normal, spontaneous vaginal delivery of a boy. The baby appears normal at birth, but 12 hours later he begins to show signs of lethargy. He becomes tachypneic. His blood pressure drops, and his hands and feet begin to feel cold. What infectious agents are most frequently responsible for neonatal sepsis? Group B streptococci, or GBS, Group B streptococci. Escherichia coli and Listeria monocytogenes are common causes of sepsis, pneumonia, and meningitis in newborns. GBS often colonizes the vaginal floor of women and can be transmitted vertically during vaginal delivery. This patient's lack of prenatal care, premiparous vaginal delivery, and onset soon after birth make GBS sepsis a likely diagnosis. What is the next step in identifying the causative agent? In gram staining of a blood sample, GBS appear as gram-positive cocci. L. monocytogenes appears as motile gram-positive rods, and E. coli appears as gram-negative rods. How did the infant become infected? These bacteria can spread through the placenta or be acquired from the birth canal during delivery. The mother may also be infected or colonized, but asymptomatic. However, pregnant and postpartum women are also at risk for GBS urinary tract infection or chorioamnionitis. What prenatal testing is routinely performed to reduce the infant's risk of this infection in the birth canal? If the patient receives good prenatal care, cultures of the mother's vagina and rectum are performed between 35 and 37 weeks of gestation to determine whether she is colonized with GBS. What treatment is initiated if prenatal testing is positive? Treatment of GBS in infected mothers or newborns involves the use of antepartum antibiotics. Let's say that again. The treatment of GBS in infected mothers or newborns involves the use of antepartum antibiotics, such as penicillin. In mothers who are colonized vaginally or rectally, but who are not actively infected, intrapartum penicillin is recommended. If the baby develops meningitis from this organism, what cerebrospinal fluid findings are expected? In bacterial meningitis, the cerebrospinal fluid may show bacteria on gram stain. In addition, the WC count is elevated primarily with neutrophils. The protein level is elevated and the glucose level is reduced.